No, not at all.
Yeah, yeah. I mean, people people always want to put a label on it. I've been called all different kinds of things, and no matter how you slice it, I'm in a wheelchair. I'm disabled. I can't walk. Whether you want to call it crippled or handicapped or whatever you want to call it. I broke my neck and I have a spinal cord injury, and I can't walk. There's certain things that I can't do. So, yeah, I mean, I view myself as disabled, but I'm still able to do just about anything I want. So you can try and put a label on me all you want. I don't really care. I don't really put any onus on it.
I do have impairment, which slows me down. But as far as being disabled, I've compared myself to some what I call uprights, and I'm more productive in life than they are. So to say I'm disabled, no. I'd just say I'm a little slower now.
That's a really good question. Do I see myself as disabled? No, I don't see myself as disabled. I feel like I can figure out how to do, pretty much most of the things that I still want to do. And so hopefully when people see me, they don't see the chair. Because, there are times when I have to remind myself, okay, you're not going to be able to get there in 10 minutes. Give yourself a half an hour. I do forget sometimes that I have a disability because I don't think of myself as disabled.
No. Actually, this hand is crippled, but no, I don't look in the mirror and go, poor me, or oh, look, you're crippled. I never did see that. Challenged? Yeah, maybe. But I mean, challenge can be many things, right? Like, how am I going to get up a hill or across the grass? I don't see it as disabled. Anybody can be disabled. I know people that, just general life can be disabled and they're not. But no, I've never seen myself that way.
I'm James Heckner. I'm 36 years old. I had a spinal cord injury almost 17 years ago at T6, T7. I'm an Asia A complete injury, and I work for Spinal Cord Injury BC in Canada, and I am the coordinator for Kelowna and the southern interior of British Columbia.
My name is Sonia Gadet, and I live in Vernon, BC with my husband. We've been married for 25 years. I'm 47 years old, and I had an accident 31 years ago. I'm a T5-6 complete paraplegic. I'm a Paralympic wheelchair curler, so I have competed at the sport of wheelchair curling since 2003. And I'm also a peer program coordinator for Spinal Cord Injury BC.
My name is Scott James. I am 31 years old, and I am retired.
I got hurt when I was 30. I'm now 37. I'm a quadriplegic, C6, C7 incomplete. I was an MVA at work, motor vehicle accident. Was a Boilermaker and a diamond driller. I now make stickers, and work for SCI.
My name's Randy LeBlanc. I'm 36. I coach wheelchair rugby, and that's what I do.
When and how were you hurt?
April 17th, 2001, a motor vehicle accident.
And what level is your injury?
C6.
I am a C6-7 quadriplegic. I was injured October 14th, 2000, and I fell off the set of monkey bars and landed on my head.
I had a car accident where my roommate just fell asleep at the wheel, and we hit a driveway approach and rolled the car. I was fully conscious after rolling the car and realized right away that I had a spinal cord injury.
I was injured from a horseback riding accident. So on my way back from a ride, my horse reared up, and the second time he went right over backwards, and I was still on him. And so from the fall, my back was dislocated at the T5-6 level, and assuming that the spinal cord was also severed, because from T5-6 I'm completely paralyzed, so no function, no movement, and no sensory function either.
I have my full arms from here up, basically. I can move this hand slightly, and this hand doesn't work at all.
When I woke up, I think it was 10 and a half weeks later, I remember looking down at my toes going, huh, and then I went to scratch my nose and I couldn't control my arms, so that's pretty much when I found out. Other than that, I didn't really know how I felt. I was glad to be awake. I was tired, but not that tired.
And to be honest with you, I felt like I must have already known somehow, because I wasn't surprised, I wasn't shocked. I kind of said to myself, wow, that frickin' horse got me. And I had a feeling all along this horse that I had was probably a flipper. That's what a horse that does that is called. And the whole time that I was working with him and training with him, I always had in the back of mind that, you know, there was something about him and he was probably gonna hurt me at some point. So when I was told, that's where my mind went, wow, you know, why didn't I listen to my intuition? Why didn't I see this coming? So I wasn't surprised at all. Certainly, my mind went right away to, oh man, what am I gonna do now? Our kids are only 3 and 6. How am I even gonna function, you know, raising young kids? And so there was all of those questions that went through my mind, endless questions.
You can talk to another cripple, but they'll be like, oh, well, I was depressed for this long. I didn't get depressed. I got blessed, probably the woman's blood, like Mom says. But it was just out of the coma. This is the way it's going. Let's make it happen. And I don't know why, even when I was in the coma, the nurses, or well, not the nurses, but the doctors and different staff took my family aside and said, look, when he wakes up, he's going to be depressed, going to tell you all to F off and life sucks and swear and kick and all this stuff. And when I woke up, that wasn't happening. And my mother had said to me, you know, it's okay to be depressed, it's okay to swear and cry and this. I'm like, hey, I don't have it in me. So I actually set up appointments with the psychologist in the hospital. I was like, hey, you guys said this is going to happen. Why isn't it happening? What's wrong with me? Why am I not dealing with it? Or what's going on? And like they said, everybody deals with things differently.
I first found out after my surgery that I was a quadriplegic. I knew I was paralyzed the moment it happened, and I was angry. I was very, very angry. And also just confused because I didn't know what life was going to be like.
There's different questions and concerns around my family versus one-on-one with the doctors. My family's concerns were more of my health and all that, and all of mine were just geared towards every young boy's concerns would be, so.
Just not knowing how I was gonna live my day-to-day life. I didn't think a lot about that in the hospital. I had a lot of family and friends there to help me deal with the situation. It was more so when I got home and had nothing to do that it really kicked in about how life was gonna be.
Well, all the questions that I had about raising my family, I really wanted to ask someone else with a spinal cord injury. And I appreciated the information that others were giving me, but I honestly didn't really want to hear it from them. I wanted, as soon as possible, for my husband to get people with spinal cord injuries into my room at actually Vancouver General before I went to GF Strong. And I wanted to ask them all those questions. And my husband was very skeptical about doing that. He felt like, you know, well, you're not ready to hear this yet. But for me, I needed that right away. And so very quickly, I had a couple of ladies, peer workers from the spinal cord, well, it was BC Paraplegic Association at the time, came in. I had a guy from Vernon who I knew had an accident, come in and literally I just ask them all those questions, you know, how do you get dressed? How do you go to the bathroom? How do you shower? What kind of clothes do you wear? How do you cook? How do you drive? How do you get in and out of your vehicle? How do you even just, you know, move from your chair to the bed? I mean, all of those questions. Yeah, how do you go to the bathroom again? I mean, how do you manage your bowel and your bladder? Of course, those are the questions that you want to ask right away, because I don't think people realize that although we're not able to walk, there's many other functions, daily functions, that we can't do either like we did before. And those are the most important ones that allow you to get on with life and feel independent and feel like you can still contribute to your family and to community and have some sort of independence and some sort of a normal life again. So I needed to hear that from other people with spinal cord injuries, and that was the biggest help for me of all.
Well, strangely enough, one of the biggest questions I had right after the doctor had confirmed medically that I had a spinal cord injury was if I could still drive. That was my number one question, and he assured me that I was going to still be able to drive. So that was strangely one of my biggest questions. Yeah, some of the other concerns that of course you have when you're going through rehab and you're trying to now readjust to the new lifestyle is definitely your level of independence after leaving the rehabilitation or the comfort zone of the rehabilitation center, and how you are going to move forward, not just with life, but financially, of course, and professionally, and how your friends and family are going to react to your new life.
I wouldn't wish this injury upon anybody just for the suffering that your family would have to do. I slept. I woke up and I had the best weight loss I ever had, but they went through way more hell than I did. I woke up from a 10-week nap, you know, Cinderella, somebody kissed me, so.
I think that there could have been a lot more help for my husband and my kids, like how to help with that transition around relationship issues, around parenting issues. So I think there was a lot of unknowns for my kids that would have been a lot more helpful to somehow have things explained to them, because we didn't know how to explain it to them at the time. I know now how to explain it to them, but at the time, yeah, I think there could have been more peer support for the kids and my husband.
Yeah, I feel the family members and close friends require a lot more support emotionally, counseling, than sometimes the actual spinal cord injury does. The spinal cord injury tends to be completely consumed with rehabilitation. It is an intense process. It's an emotional process, very physical. There's a lot of learning involved, and I feel that a lot of times the family members tend to be neglected.
I think that would be pressure sores. I seen a big poster with all the different stages of them, and I think they should be everywhere for any spinal cord injury, because that's probably the number one killer. And if you don't realize what they can do and how to prevent them and how to recognize them, how to treat them, that was the biggest thing I learned.
The most useful thing I learned was from a poster that was on the elevator door. Actually, it talked about attitude, and it was a whole paragraph. And only one line really sticks out to me now, and it was that life is 10% what happens to you and 90% of how you react to it. And I remember that was about 3 months into my injury, and I remember waiting for the elevator, reading that, and just it struck a chord with me, and just realized that I had to be upbeat. I had to just take it one day at a time, and be positive, or else it was going to eat me alive.
I think one of the most useful things I learned was from Rick Hansen, because his kids were the same age as mine, and I definitely, you know, my biggest concern and all my thoughts went right to my kids. And so I'm very fortunate that I had that motivation, that inspiration to, you know, find out how quickly I could get better, because I needed to get back home from them. So he showed me, you know, how I would be able to manage a 3-year-old child and a 6-year-old at the same time, going shopping, going to the mall. I mean, doing all the things that you have to do with kids, getting them in and out of car seats. So I was very thankful to hear that from him, that I would still be able to do all those things and be a mom, you know, like I was before.
I would say that the most useful thing, the most useful encouragement that I had after a spinal cord injury, and it's just started rehabilitation, so it was the first day that I had been moved over to the rehabilitation ward, and one of the nursing staff came into my room, and they were well experienced. They had been on the rehabilitation ward in Calgary for a number of years, and the first thing that he did is he handed me an intermittent catheter, and he said, "Now it's your turn." And I was shocked. I'm like, well, what do you mean it's my turn? And that's when rehab began.
What was the least useful thing that you learned or someone said to you in the hospital following your injury?
Oh, you can't do that. Can't what? That can't is not in my, as far as I'm concerned, in my vocabulary. How can I? You know, yeah, okay, I can't go upstairs, but how can I get up those stairs? You can let can't stop you with anything, able-bodied or disabled, right? I mean, it's all if you want to. So can't was my biggest. Can't didn't come in my room. How can I? Or, you know, maybe not today, but the next day. Or
I had somebody tell me to practice typing, and my hand would get better. And I asked them if I should practice walking too.
I had a very negative experience in the hospital. My husband and I were just down having coffee one afternoon. He's looking at me going, "Yeah, something's not right with you. Let's get you back up to your room." I felt totally fine. I didn't know what he was referring to. So they got me up there, and right away they could sense that I must have had, well, I had a blood clot. And they sent me down for tests right away. They found the blood clot was in my lung. So I needed to, you know, stay very, very still, and they needed to get the blood thinners in me as quickly as possible. But of course, I wasn't going crazy, but I certainly was very nervous. And everybody around me, like all the nurses, were major panicking, yet asking me to stay calm. And so I was trying to stay as calm as I could, yet watching them completely panic around me. And, you know, I had actually just prior to that had all of my lines pulled out. So I didn't have anything in me anymore, no intravenous, no PICC lines, if that's what they're called, I believe. And so they started going in, you know, here, and of course they're panicking, I'm panicking, my veins are gone, and they couldn't get anything in until they got up to here. And I was reflecting back on that later, I thought I couldn't believe how panicked they got, because it didn't help me at all. And, you know, they actually got quite mad. One particular nurse got quite mad at me once, and I thought, wow, you're panicking more than I am. So yeah, that was a really negative experience. And certainly now needles, like I freak out from needles. And I always go back to that experience.
Yeah, I mean, bladder and bowel function after a spinal cord injury is probably one of the biggest challenges that you have to overcome. Being that depending on your level of injury, mine is a T6-7, thoracic 6-7, so it's up here. But so if you're a complete injury like myself, an AJA, it's going to not only lose your sensation and mobility from your injury down, but it's also going to affect your bladder and bowel function. And creating a routine is absolutely essential, and it can take a year to 5 years just to get your bladder and bowel routines set up properly, where you're not so anxious to necessarily leave the house or go on vacations. So it takes due diligence, takes time, and I highly recommend making sure to have a good routine every day.
There was slight change. I lost full function of bladder and bowels. There was a lot of accidents. There still is accidents. You just have to put yourself on a routine and play it safe.
Oh,
How did you adapt to these changes?
I strapped a bag to my leg for peeing, so that became easy. But the bowel thing, that took a few years. I don't know. Everybody had a different routine. Like I say, I started with disinfection, and by the time I got home, it was just, like I didn't want to live in a diaper, so I pretty much self-trained with suppositories and hearing other people try this, do this, and then it became a routine. And after that, it was clear sailing. I mean, you hope for the best and shoot for the worst. I know that's backwards.
Yeah, I had massive changes. That's by far the hardest part of being injured. Having this happen is having to lose your dignity in that way, in that regards. I had a lot of trouble getting my bowels under control, and still battle with it, trying to find routine. I've never been a really routine type of person, and so to try and incorporate that into my life has been ridiculously hard, as well as, like I said, the embarrassment of having accidents around family or friends or new girlfriends.
The biggest thing that I struggled with by far after my injury was getting my bowel routine organized. I was told by counselors and physios, all the professionals who went through the process, that it's good to take a year off and adjust to your new life, your new body, and get yourself on track, get a routine and all that on track. And then after a year's time, it is best to get back into some sort of a career or school or volunteering, something in the community, and get back on with life.
I think the biggest hurdle for me is nothing to do with my personal issues, but just my friends and family, seeing how I just wanted them to be the way they were before, and everybody get along and be happy. And I mean, it did bring the whole family together, a crisis too, but they just didn't see me the way that they used to.
Yeah, I do have autonomic dysreflexia, and I've experienced it a few times. Certainly if I have a really bad bladder infection, I will go dysreflexic. I had a little cut on the back of my toe, just where your toes or your fingers can split like that, and had no idea. And I remember being told at GS Strong, like, check your toes all the time. I thought, give me a break. What do I need to do that for? Well, I learned very quickly that, there was a tiny little cut there that got a little bit infected. And before you know it, I've got, like a blood infection. And I went very dysreflexic from that. I'm glad that I have autonomic dysreflexia, though, because it definitely is a warning sign. You've got to start searching for something's not right.
I get it with bowels and bladder. So like when I broke my femur, I didn't notice until the swelling. My leg, same idea. But I've had a catheter plug and I get the hiccups and sweating. same as the bowels. I get really intense sweating, but at first everything was the same. Whether it was pleasure, pain, bathroom, everything was the same symptom. So you get warm, flush, and even now you still do the checklist, right?
There's 3 things that you have to check right off the bat, and that would be, first of all, bladder, bowels, and number 3, check your skin. I mean, realistically, it's one of those 3 things.
And I would strongly suggest for people not to mask it with drugs like they push on you, because your body's, you don't control your body now, but it's still operational, and it's found new ways to tell you, hey, look, something's going on. It's not like, oh, my head hurts, I have a headache. It's always, oh, my head hurts, something's wrong. So it's a process of elimination. You gotta check out, it's one warning sign for everything. So at least your body's telling you, you just gotta do a checklist and you'll figure it out.
I was a very flirtatious, outgoing person before my injury. And afterwards, I really lost that part of myself. I lost the confidence. I lost how to interact with people. Trying to find a girlfriend after was really kind of awkward. I didn't know how anybody was going to deal with the condom catheter. I didn't know how anybody was going to deal with having to deal with the bowel situation. So I lost a lot of that, and I lost it for a long time. And only in the last 5 years that I've really gained that confidence back and kind of got a little bit of a swagger back in my wheel a little bit.
I would definitely say that, yeah, my spinal cord affected my self-confidence. Not a ton, but because I was blessed to be able to have a husband that has been very supportive, and we're still together. Definitely some of the first times going out into the community, I was quite shocked how people perceive those of us in wheelchairs. So that has caused a little bit of a lack of self-confidence. I think maybe just the person that I was before allowed me to overcome that and push through it. But it still throws me for a loop sometimes how people discriminate against people in chairs, or don't talk to me, talk to my kids first when they're like 5 and 7, and I'm thinking, hello, I'm here, like, talk to me. So I think definitely there's a lot of assumptions that get made, and that can throw my self-confidence for a loop a little bit. But over time and getting introduced to different sports and really realizing that I could still really have a great quality of life, sport has really helped me regain that self-confidence that I had before.
I met people through sports. 2 years or a year and a half post-injury, I met Tyler Tingle in Kamloops, and he opened my eyes to, because I used to race motorcycles, and he's a para and he's on a drag sled in Ashcroft, and it made you, like you always saw that star you wanted to reach, and it made you, oh, wait a minute. Just because, you hear can't so many times, you just adapt to what you can. So you stop pushing for that. And he definitely opened my eyes to like push to the envelope, like do what you want to do. Don't let anybody stop you. And yeah, no, people like that. I met a few guys in like Kelowna, like James there, going to Lake Havasu and that, like just genuine people that, I don't know. There's definitely a different community once you add wheels to your ass as opposed to, uprights or walking people, right? Not that there's a difference. It's just I've definitely met a different aura around people. That's for sure.
Communicating with different people that are injured, whether it be a paraplegic or other quadriplegics, you can take what they do, and you might not do everything that they do, but you can incorporate some of what they do into your life, and the communication in between paralyzed people is just paramount to people's recovery, because you can nurses kind of teach you one way, and they have to teach you how it almost best serves them when you're in a rehab center, because they need to get stuff done. Whereas when you get home, you need to find what works for you because you're in a certain situation. So to talk with other people that are paralyzed is just, it's fantastic to find out what they do and incorporate that into your own life.
I would say the biggest thing is try to keep a fun environment, not per se joke around all the time, but don't be so serious and by the book about everything. You'll get to know each patient and what they can tolerate and what kind of person they are, and just work with that to help them through what they're going through, because just the stupidest little things bring comfort to somebody. Yeah.
Nurses hold probably a key role in, well, they do hold a key role and probably one of the most beneficial roles on the spinal cord ward for sure. Also, nurses on the rehabilitation ward that I was on also provided a huge role or key role in emotional stabilization. And I would highly recommend any nurses that are going into this type of a role to put the bureaucracy aside, put the paperwork aside, remember why you're doing this, and take that extra few minutes with your patient to sit down, talk to them, and more or less just listen to them. You don't need to tell them anything necessarily unless they ask, but just to sit there one-on-one and really pay attention, really listen to what the person's going through. Because the fact is for most of you that have been on a rehabilitation ward like that, you have an immense amount of experience, which goes a lot further than any education that you're going to get. And you have something extremely beneficial to provide to your patient.
The one thing that I would want people to know about having a spinal cord injury is that it doesn't change who you are. You're still the same person, and I think people need to realize that at any given day, any one of us can be in this same situation, and it doesn't change who you are. You just have to learn how to do things completely differently. And I think that the general public needs to remember that any one of us can have our life change in a second like that, because most of us with spinal cord injuries, that's how our lives change. We never imagined that we would be in this situation, and in a split second we went from able-bodied to being disabled. And I realize now more than anything that it can happen to anybody. And so I am a little bit frustrated when there is a negative attitudes and assumptions that get made. And you feel like saying that, like, hang on a second, like, you can leave this room and be in my shoes like that.
I'd want them to know that it's okay for them to talk to us normally. We don't get offended easy. Most of us are happy people, and I find there's a lot of people that won't look me in the eye, that won't deal with me as a person. And just to let them know that, you're not going to offend me with what you say. You're not going to offend me with questions. I'm a very open person, and as long as you go about it in a tactful way, I will tell anybody anything. So I'm very quite comfortable in my own skin these days, and so just to treat me like a normal person.
Control my bowel and bladder. Other than that, I mean, the rest is just superficial, right? Like,
One thing that I can't do now that I would want to do.
Play hockey. Straight up. I'd love to play hockey again. And not no sledge hockey or sitting on something. I just want to skate. I would just love to have that feeling again and not even play hockey, just skate. Just feel that wind in your face and nice fresh cold feeling you get in the arena, and yeah, I miss it. I miss it a lot.
I'm trying to think if there's anything that I can't do anymore that I would like to do. And what's coming to my mind are things like, okay, go skiing. But I have skied. I've skied in a sit ski. Okay, I would like to go water skiing, but I have water skied now. So, it's a great question. I think, you think, I'd like to do those things maybe the way I did them before, but I know that I can still do them now. I'm just going to do them differently than before.
Yeah, I don't know. I'm really trying to think. I mean, I'm sure that there's probably something, but obviously it's not that critical.
I don't know. Jump?
as far as I'm concerned, legs are just overrated.